it's Nicole from the Physio crew, and I've got a meeting at 11, so I've got to get there, so I've literally got a few minutes to do this next video, which is talking all about arthritis. Now, there's lots of myths surrounding arthritis, number one being that you're going to wear your joints out. So whenever you say arthritis, people get this horrible big vision in their mind about the fact that their joints are wearing out and that their bones are changing. But in reality, most people who are older are going to get arthritis, and not all of them will experience pain. So we know that you can have x-rays which have bone-on-bone arthritis and you don't have pain. We know that you can have x-rays that are completely clear but you do have pain. So arthritis and the condition of the bones, yes, as we age they do change. Often they won't be painful, and we need to get away from this idea that we're going to wear the joints out. What we know is that if you don't move, your pain is going to be much worse. I saw a lady, she was in her 40s, had early onset of arthritis in her hands, and because the doctor had said to her she had arthritis, she'd been scared to move them. Her hands had got to the point that she couldn't even lift up a pen, she couldn't even write her name. This is a 40-year-old woman, and she had to take time off work because she wasn't able to do that. I saw her for one session, gave her some exercises, educated her about arthritis and the fact that you need to move. Synovial fluid is within the joints. Every time you move it, that's lubricating the joint. So that's why we have to move with arthritis. This woman, I gave her some very simple exercises looking at all of the individual joints of the hand. So I gave her this one here. I used putty because she needed a bit of resistance. We did finger to thumb, finger to the base. I got her to do them in hot water because I know that helps to relax the muscles and helps to reduce pain as well, particularly for this type of arthritis. And so I got her to do all of those exercises. So she went away for a week, came back, and she said that she couldn't believe she was able to use her hands. She'd been experiencing like 8 or 9 out of 10 pain, hadn't been able to use her hands, and now could. I did see her for one follow-up after that, just to check how she was going, and her symptoms are completely resolved, and she couldn't believe that she'd spent so many months not being able to work, not being able to use her hands, just because she'd been so frightened to move. And that's the value of speaking to a professional. They can help you understand what is good pain, what is bad pain. So I'm going to tell you about the 3 concepts of arthritis. So the first one, which is a huge myth, is that you're going to wear your joints out. We know that if you are overweight, that has an increased risk of osteoarthritis. So the first thing that you can do is look at losing weight. The Barnstable Clinic is an absolute training in nutrition. These guys are absolutely amazing. If you haven't been able to lose weight in the past, if you've tried Slimming World, if you've tried to go to the gym on your own, it hasn't worked, if you tried personal training, you need to come and see these guys. They're absolutely unreal, and gals. They're absolutely unreal. They look at things in a holistic way. They look at the nutrition, they look at the exercises, they look at giving you one-to-one personal training to make sure that you're reaching your goals. And I've seen the results in here. Just go on their website, you can see the difference from A to B. It's absolutely incredible. So make sure that you're looking at weight, and don't avoid doing exercise. I know that when it's painful you think, oh well, I don't want to move it because what if I'm doing more damage? What you need to do is you need to identify the sort of movements that might aggravate the symptoms. So for example, we know with something like knee arthritis, running, jumping, hopping, skipping, before the muscles are strong, that's going to be too difficult for you to do. But something like a static quad, where you have you're sat down, your knee is straight, you're pushing down, can be the difference of you being able to walk normally again. If you're walking around with a bent knee, that's going to be very painful. So we need to recondition those muscles. And people often think, oh well, you know, it's not going to make any difference, the problem is with the bones. But what they don't realise is it's all the compensation that's happening around. They don't realise that it's to do with the strength around that area. If we strengthen the hip, that often has an effect on the knee. I'm going to start trying to bring in some evidence to these videos as well, so you can actually look at the literature. So we spend a huge amount of our time going through evidence to see what exerciser is exactly right, how you're perceiving pain, how you feel it in the brain. We learn all of that, and we help you understand it as well. But that's really important in pushing forward with osteoarthritis in most joints, so knee, hip. But we help you understand what exercises are okay. So concept number 1 is going to be to help you lose weight. Myth number 2 is that you're going to wear your joints out. That is not going to happen. We need to get you stronger. And number 3 is just understanding about good pain, bad pain. And if you're feeling a little bit worried about that at the moment, if you're not sure, then go and see a local physio and make sure that they are, you know, proper qualified, because a lot of people think they're seeing a physio when they're not at all. So make sure they've got a 3-year degree just in physiotherapy physiotherapy, then you know there's a standardised education there. Try and make sure you're seeing someone who is experienced, so like an MSK or a sports physio is going to be really, really good at post-surgery or following a sports injuries, shoulder specialist, but physios, if they're in an MSK, you don't necessarily need to just see a shoulder specialist unless you've had it for a really, really long time and it hasn't changed and you've seen other physios that haven't worked. You need to make sure that you're investing when you go in to have your physio, whether you're having NHS physio or private physio. You need to invest in it. You have to do what they say. You know, it's the kind of same as with weight loss. If you want to lose weight, you can't just eat cake and do no exercise. Like, you have to look at all of the things that contribute to it and make that change. Anyway, I hope that video has been helpful to you. I'll see you all later. Bye bye.